Are you tired of contradicting advice about what foods really work to decrease inflammation? Stop scrolling right now if you are confused. Today I'm breaking down 15 inflammation-fighting foods, ranking them from the least to the most effective, backed by real science, not just internet trends. Hi, I'm Dr. Girnita, a board-certified rheumatologist, and every day in my clinic I see patients overwhelmed by conflicting dietary advice. They are confused by Paleo, Keto, Carnivore, or Elimination diets, and many people have unnecessarily given up foods that they love. But today, I'm sharing with you something different, a scientific-based approach that doesn't require extreme restrictions. But before we dive in, let's understand what is inflammation. Inflammation is your body's natural response to injury or disease. But when it becomes chronic, meaning that it evolves over years, it causes damage to your body, and it will lead to diseases like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, or even gout. The foods that we will discuss today have been proven to help all of these conditions, and we will rank these foods into 5 tiers. We'll start with D tier, which contains mildly effective foods, C tier, which contains moderately effective foods, B tier, which contains effective foods, A tier, which will contain very effective foods, and S tier, which contains the most powerful foods against inflammation. And each of these are backed by scientific studies that I will share with you. Now, starting with our D tiers, or mildly effective foods. Garlic, ginger, rosemary, and pepper can fight harmful germs, but will also protect your cells and reduce inflammation. If you have rheumatoid arthritis, these spices might help reduce your joint pain and swelling. But there is a catch. You need to use a lot of spices to get these benefits and not just use one spice alone. Instead, try mixing several together. Remember that using spices once in a while will not help you much. You need to cook very often with them, making them part of your daily meals. Next in this tier, we have enzymatic fruits like papaya, mango, and pineapple, which were also shown to reduce inflammation in people with inflammatory conditions. However, the evidence is still small, and some people who have diabetes might be limited to eat a lot of fruits. Let's stop for a few seconds. Recently, I started offering the option to become a member of my channel. If you find value in my videos, consider become a member by clicking the join button below. This will help me continue to create high-quality content for you. Now let's move on to foods with more scientific backing. In the C tier, I have included foods that are proven to have moderate anti-inflammatory effect. First, let's talk about chia seeds and flax seeds. Chia seeds are an excellent source of omega-3 fatty acids, but their biggest benefit is probably their high content into fibers, which will fill you up and help control your weight. Flax seeds also contain fiber and lots of omega-3 fatty acids. But why is fiber essential to you? Your gut is full of tiny, helpful microorganisms that we call microbes. These microbes absolutely love to eat fiber, which they will get from what you eat. When you give your microbes plenty of fiber, they get all the food that they need to stay healthy. After these microbes digest the fiber, they make special substances for our body called short-chain fatty acids. And these short-chain fatty acids are very important because they will help you reduce inflammation in your body. When there is less inflammation, you might have less arthritis, less pain, less stiffness in your joints. It is like a chain reaction. You eat fiber Your microbes get fed and then they help your body feel better. Second in this tier, I included vegetables like broccoli, spinach, kale, and asparagus. They contain a lot of vitamins and also fibers. And the darker the color, the better they are. Why are they good? As I said, they contain lots of fiber, which will make you feel fuller for a longer period, will decrease your sensation of hunger, and will help you maintain a healthy weight. Now, leafy greens are the base of the vegetarian and Mediterranean diet, both of them with great benefits for rheumatoid arthritis, psoriatic arthritis, gout, and osteoarthritis patients. Now, last but not least, in the tier are fermented foods. Fermented foods are natural sources of probiotics that will help your gut decrease inflammation. A few examples are fermented dairy like yogurt, kefir, cultured sour cream, or other fermented foods like sauerkraut, pickles, or kombucha. All of them are powerful anti-inflammatory foods. Now this is where it gets interesting. In the B tier, I included foods that I have seen consistently to show benefits in the studies, and they are considered effective in decreasing inflammation. First, let's talk about whole grains. Quinoa, wild rice, brown rice, or gluten-free oats. Whole grains are packed again with fiber, which helps you in many ways. When you eat them, as I said, you feel fuller, which will help you avoid overeating. They can also help you lower your cholesterol and keep your digestion working smoothly. Research shows that eating whole grains can reduce inflammation in your body. And this is especially helpful if you have rheumatoid arthritis or psoriatic arthritis. For people with gout, eating more whole grains might lower your risk to get many painful gout attacks. Remember those friendly gut bacteria that we talked about? Whole grains feed them very well, which helps you reduce inflammation and also arthritis symptoms. Another bonus is that whole grains can help you maintain a healthy weight. And this is important because staying at a healthy weight reduces your chances of getting arthritis or making your arthritis much worse. In a study published in 2021 that looked at patients with rheumatoid arthritis, patients that removed gluten foods along with lactose and red meat for about 3 months, they showed a significant improvement in pain and inflammation. As I mentioned when I talked about seeds and vegetables, adding more and more fibers to your diet will increase the production of short-chain fatty acid, that metabolite that is produced by your gut bacteria, and that will help you decrease the inflammation in your whole body. Now let's talk about legumes such as beans, peas, garbanzo beans, and lentils. They are not only rich in proteins, fiber, actually lots of fiber again, and vitamins. Think about the B complex vitamins like B1, B2, B6, but they are also rich in minerals like iron, calcium, potassium, phosphorus, and zinc. Because of their high protein or high fiber content, legumes avoid insulin spikes and again will help you prevent hunger, will lower the risk of obesity, diabetes, and arthritis. And legumes are also the staple food in the Mediterranean diet, so I encourage you to eat lots of them. Eating more legumes helps patients with rheumatoid arthritis, psoriatic arthritis, gout, and osteoarthritis. Now we are making progress, and we got now to A tier. These are foods that are backed by multiple clinical trials, and they are shown to be very effective in reducing inflammation. First, olive oil and nuts. Interesting combination, right? A large prospective, randomized controlled trial published in 2013 showed that people who are using extra virgin olive oil consistently and people who are eating about a handful of nuts every day, they have a reduced risk of developing heart disease with 30% over 5 years. But that is not only beneficial for people with heart disease, it is also beneficial for people with rheumatoid arthritis. Now look at this study that showed that people with rheumatoid arthritis adopting a Mediterranean diet will report a reduction in their pain. Yes, that is impressive, better than many medications. My advice, use olive oil every day. Buy a good quality olive oil that is cold pressed and unfiltered, and if it's possible, not older than 6 months. If you're not allergic to nuts, eat a handful of nuts every day and combine them. Combine walnuts with cashews, pecans, pistachios, almonds, and hazelnuts. Second in this A tier are cherries. Now, in patients who suffer from gout, cherries were found to have great benefits. Here is just one of the studies that show that eating one handful of cherries every day will reduce the risk or will reduce the frequency of gout attacks. But if you want to fight inflammation, you need to consume many foods from the next tier, the S tier, where I included the most powerful anti-inflammatory foods. These are the absolute best, backed by a lot of studies. Let me start with berries. Blueberries, strawberries, and blackberries are great for people with arthritis like osteoarthritis, rheumatoid arthritis, and psoriatic arthritis. In 2017, a study on 300 patients with rheumatoid arthritis showed that people who ate blueberries and strawberries felt better with less pain and less inflammation. Another study in patients with knee osteoarthritis showed that patients who drank a daily dried freezed strawberry smoothie for 12 weeks had an improvement in their quality of life, their inflammation and pain levels. A similar study on blueberries found that rheumatoid arthritis patients who consume 1 cup of blueberries every day, they enjoyed significantly lower markers of inflammation. That's impressive, right? My advice, try a berry smoothie a few times a week and you will experience less pain. Next in this tier is fatty fish. Why? Fatty fish like sardines, salmon, trout, and cod have a high content of omega-3 fatty acids, which are proven to decrease inflammation. Many studies have shown that eating a diet higher in omega-3 fatty acids or even taking a supplement with omega-3 fatty acids, but I strongly recommend the foods as a natural way of obtaining them, will decrease inflammation, pain, swelling, and most importantly, will decrease your need to use more anti-inflammatory medications like ibuprofen and naproxen. And now, this might surprise you. Last but not least, a spice often used in Asian cuisine, also called the golden spice, was shown by hundreds of clinical studies to decrease inflammation. What is this spice? Turmeric. The powerful secret of turmeric is its active ingredient called curcumin. In my research, I found more than 1,000 studies about turmeric and inflammation, and more than 120 were clinical studies. Curcumin can help fight inflammation through several mechanisms, but one important is that it blocks the COX-2 enzyme, which is the same enzyme that is blocked by NSAIDs like ibuprofen, and in this way will decrease inflammation. You may use turmeric in your food or you can take it as a supplement. Actually, many of the studies that I found were related to supplements, but I strongly encourage you to use turmeric in your food. Let me tell you about the studies related to supplements with turmeric. In 2016, a study that included many randomized controlled trials found that 1,000 milligrams per day of curcumin or turmeric reduces osteoarthritis pain and inflammation and reduces the need to use anti-inflammatory medications like diclofenac and ibuprofen. And this is very important because if you have contraindications like heart disease or if you have a previous GI bleed, NSAIDs are not an option for you. In a more recent study in 2020, this was a randomized controlled trial in 70 patients with knee osteoarthritis. They compared curcumin with placebo. And here are the results. Patients who received curcumin 1,000 milligrams every day for 3 months had less pain when compared to placebo. When it comes to patients with rheumatoid arthritis, the results are equally impressive. In a study from 2016 on patients with rheumatoid arthritis, they found out that curcumin 1,000 milligrams per day for at least 90 days resulted in decreased inflammation, decreased pain, and decrease in the number of tender and swollen joints. Even in patients with psoriatic arthritis, a study published in 2020 showed that curcumin improved both the skin and the joints disease. And you have to know something, the dose matters. These studies show that using a dose of 1 to 1.5 grams of turmeric per day seems to be effective. Now, it is better to be a supplement that is enhanced with pepper because that will improve the absorption of the supplement. Yes, all of this is true, but there is so much more that you need to know. So make sure you watch this video where I explain exactly what foods are creating more inflammation in your body.